I wanted to first start by thanking the NCCN for inviting me and the NOCC to be part of this webinar, and also thanking Dr. Armstrong and Amy for sharing this valuable information on ovarian cancer to survivors on this webinar. I just wanted to share a little bit about myself. I am, like most of you on this call, a survivor of ovarian cancer, and that is what brought me to the National Ovarian Cancer Coalition. Our mission is to save lives by fighting tirelessly to prevent and cure ovarian cancer and to improve the quality of life for survivors. And we do this, oops, I forgot, there we go. We do this by focusing our work on 4 pillars. The first being early awareness, the second is quality of life, third, research, and fourth is community outreach. I will talk a little bit about early awareness. And I am sure that most of you who are listening are survivors and caregivers, and I am guessing that many of you didn't know much about ovarian cancer before your diagnosis. And I'll bet that many of you had some of the symptoms of ovarian cancer, but didn't even think that ovarian cancer was a possibility. Some of you may have even been misdiagnosed initially. Maybe you saw a GI doctor or a primary care doctor, and they told you you had reflux or irritable bowel or fibroids. It's so important for us as a community to get out and educate women so that others understand the symptoms and the risks and that they can advocate for themselves. We do this at NOCC by attending hundreds of health fairs around the country where we distribute tens of thousands of early awareness materials each year. If you have an event in your community or you have a desire to share this information, you can certainly order materials from us and we will send them to you. A little bit about research. NOCC has been one of several ovarian cancer advocacy groups that helped fund the Stand Up to Cancer Ovarian Cancer Dream Team. This key initiative of this team was to offer free genetic screening through the Magenta trial, and as a result, we have seen advancements in genetic testing and DNA repair through targeted therapies such as the PARP that Dr. Armstrong shared. I'm going to talk a little bit about community outreach. We have chapters around the country, and we are active in many communities, cities like Boston, Chicago, Dallas, Phoenix. Our biggest outreach effort in these communities is our Together in Teal run walks. We mobilize supporters and invite the community in. And in 2020, all of these events will include an interactive expo, so attendees leave more knowledgeable about ovarian cancer and the ways they can support. Also new this year and leading up to World Ovarian Cancer Day, which if you didn't know is May 8th, we are doing a campaign called Rock the Day, with ROC standing for Raise Ovarian Cancer Knowledge. And we encourage individuals to host activities aimed at raising awareness for ovarian cancer. Lastly, I want to talk a little bit about the quality of life programs that we have. And first, I'm going to talk a little bit about the Faces of Hope totes. So some of you may have received those. Many hospitals around the country participate in this program, and it's a tote bag full of care items and information for the newly diagnosed. If you did not receive one and you are interested, you can certainly contact our offices at ovarian.org. Cancer Connect is a HIPAA-compliant online physician-moderated forum for anyone affected by ovarian cancer, and can also be accessed by our website. And that's a great opportunity for survivors to connect if they are not near a local chapter. We do offer local financial assistance for people who are going through treatment, and we are doing that in Long Island, Philadelphia, and Boston right now as a pilot program. We are supporting women with transportation, food, and house cleaning, and we hope to roll that out to other communities as well. Our Teal Hearts Network is just local support groups and informal meet so that, again, people can get together. We offer survivor retreats, and here in DC, for example, we had a day-long Rejuvenate retreat, and it wasn't a time when we were talking about medicine like we are today, but it was more about how to live your life after you've had a cancer diagnosis. So we addressed topics like sexuality, nutrition, writing as therapy, meditation. And so we have several of those events going around the country. And then the biggest, where we bring everyone together, is our Teal Summit. And that is on October 16th through the 18th this year in Dallas, Texas. And I'm just going to leave you here with a little bit of contact information if you want to get involved. I will hand it back to Erin, I think, who maybe, or Dr. Armstrong, so we can answer some of these questions that are here.
Thanks very much, Alana, and also to Amy and Dr. Armstrong. Before moving to our question and answer session, the NCCN Foundation would like to take a moment to thank the industry supporter of this webinar, AstraZeneca. In addition, we invite you to provide feedback on this patient webinar by taking a brief survey. We very much appreciate any feedback received, and we encourage you to do so. The survey is brief. It should not take too long, and again, it is much appreciated. Also, if you would like to receive news from NCCN, you can do so at the NCCN website. And now we will move along to our question and answer session.